Awesome. Thanks everyone for taking out the time and for walking through all these presentations. I think all the companies so far have been great. I'll give you a little bit of background on Memora, and then we'll go ahead and jump into the deck. So really broadly, we're a healthcare technology company based in San Francisco that helps organizations automate and digitize a lot of their communication practices, right? So really our core focus is addressing the fact that across the board, member communication is highly fragmented, right? In a lot of cases, people are getting outreach from phone calls. In some cases, a lot of it is paper-based. In some cases, it's going out in mailers. In some cases, some organizations have developed more comprehensive apps and things of that sort. But across all of those, one, it's really difficult to identify, through all of the data that you say transiently will collect, but not process right now. One, where do you actually have accurate contact information? As Chris just mentioned. Second, in a lot of cases, identifying what are things that folks are actually engaging with and what are things that are working well and not working well. And across the board, we'll see that, as you've mentioned, there really is not a single strategy that works well for an entire population. It's always a combination of several different types of outreach, right? So our core focus as an organization is we construct member-specific outreach programs to automate communication, accelerate data capture, and improve the member experience across the board, right? And we use a lot of different practices as a part of that. So one of our almost superpowers as a company and as an organization is that we leverage a lot of tools related to natural language processing to develop a really deep understanding of members. I think one just fundamental understanding that we've developed working with over 40 different healthcare organizations across the country now, including health systems, payers, life science companies, kind of across the entire spectrum, is that in most cases, no matter how many external insights we can kind of bring to the table from third-party sources, any sort of background that we may have on certain members or anything of that sort, your organization has already done so much heavy lifting and has such a detailed understanding of how this particular population operates that when we start working with an organization, we will try to leverage as much of that data as we can. So we've developed an entire engine around taking existing phone call recordings that your organization will have, educational packets, any sort of existing contact information that you may have, right? And we will use a spectrum of one, external libraries that we rely on, and then second, natural language processing tools that we've developed to quite literally create these engagement models or these engagement programs, right? And we will, across that, actually identify, look, what is every piece of outreach that a specific member is receiving right now? What is the type of outreach that is working for different types of members? Exactly as Chris mentioned on the last presentation, if there's phone number information that's already stored, we will do a reference check, and we have a library that will assess whether or not that is a landline or mobile phone number. We will reference check that with a ton of other external databases, such as voter registration information and things like that, to identify if we have the most up-to-date information, right? And we will actually do two things, right? One, from taking all this information on the members, we will construct these quote unquote profiles for each of these members that identifies what is all the information that we have, what do we actually need to reconcile and update in that information, and what are the different types of outreach that they've actually received to date. And we'll show you quite literally a timeline of all of those different pieces of information. And then second is we will construct these digital outreach programs that are entirely tailored to the content that your organization has developed so far. So I think a belief that we have is that, while there's a ton of external insights that we can add to the existing outreach programs that organizations will have to make them highly efficient and highly engaging, the core content that underlies that is not something that we as an organization should be providing, right? It's something that your organization has already done a ton of research to develop, understands what types of messaging may be working really well right now, or what may not be working really well right now, which is where we may jump in, right? And we'll quite literally construct these quote unquote outreach programs, which I'll show you an example of in a second, right? So that entire process is, I think, our bread and butter, right? We will co-design what an engagement program will look like. And there's four kind of core steps to that. We'll start by mapping all of the existing workflows that your organization will have, all of the existing pieces of information, what is going out in the mail, all of the phone call recordings and things like that, ingest all that information and quite literally structure it into these digital programs. Second is use that to create these customized workflows and identify quite literally these personas of members and say, for, let's say, someone who recently delivered a baby, right? and lives in a particular geography, right? What type of outreach has historically worked for you all based on who's actually picked up the phone, right? If you have that data stored in a CRM or in a data warehouse or whatever that may be, what types of messaging worked? How frequently did they actually engage in the status quo, right? And we'll quite literally tie a workflow to a specific member persona or member type, right? And then the third component is actually reaching out to these folks, right? So we'll identify what are different channels that work well. There's an entire process that we go through upfront with every single member where we will ask them a set of information about communication preferences. One, if we, by default reach out to them in English and they interact in a different language, we will adjust the language based on that, which I think is a core functionality for us. Second, we will say, if we start with SMS and we don't get any sort of engagement there, we can try pinging them on another channel. We can try manually reaching out to them using kind of a care management-esque process. And then based on that, update the information in our system that will automatically kind of update and things like that to identify what is the best almost like dosage and best combination of different channels that works really well, right? And then we'll use that to one, increase efficiency, and then second, actually benchmark how the member experience and retention is going, right? So what does that entire journey look like for us? I think that the second most fundamental understanding that we've developed outside of the fact that the data that you all have is significantly more valuable than I think most organizations currently realize, is that member engagement is not like this. It's not this one-off process where you can engage them around enrollment and eligibility and that's kind of it. And then you'll have to implement a completely different intervention for explaining their benefits to them or a completely different intervention for any sort of care management process, right? It's all embedded into one experience that they want to have, right? And they want to feel as if they are being guided through these different episodes of care that they may be receiving, right? So our process is we'll start by reconciling their contact information, setting their preferences for outreach, setting their language, setting quite literally, we'll construct these engagement models where we will set the reading level at which certain messages should be sent out for different types of populations. We've gotten feedback across the spectrum of, I'm not entirely sure what this means to, it's okay if you give me more information, right? And people where we'll send a message at an 8th grade reading level, we're requesting something a lot more complex because they feel as if they just want more information, right? So we'll construct that profile and we'll reconcile their contact information. We'll automate really basic interventions or what we call modules around things like enrollment and eligibility outreach. In a lot of cases, even reminders for picking up certain prescriptions if we have that information, reminders around certain, say, proactive visits. So we've done a lot of work around, wellness visits. We've done a lot of work around flu shots, a lot of work around COVID screenings, an entire spectrum of work around cancer screenings proactively and things like that. So we'll construct a lot of these quote unquote modules and you can decide what you want to turn on and off based on existing interventions you have in place that we've digitized, right? Third, after we've automated a lot of that basic outreach, we'll layer on additional interventions, right? So we'll say, look, we know for a fact that this particular member is engaging really well with these particular modules. We've surveyed them and automatically, we understand what their net promoter score is. We understand what types of messages they're engaging with, quite literally down to the detail. We understand what time of day they're engaging really well. And based on that, say, look, we should try to layer on an additional intervention here that could be valuable based on any sort of information we have about their care plan, right? And try to, over time, create a more and more comprehensive strategy just automatically based on how the technology operates for each member so that it's truly customized. And then lastly, beyond just the automated functionality, beyond a lot of the conversational AI where members can interact with the system, where we can identify different strategies where if they stop engaging over SMS at any point in time, we reach out to them over email. And then over email, if they don't respond, then we have someone manually reach out to them, right? And make sure that the channel that we're reaching out to them consistently is working, right? So there's kind of 3 steps in constructing that engagement model, which I'll run through quickly. First, we'll identify what types of content do we want to deliver to existing members? What are the existing programs you have in place? What types of phone calls are working really well for your organization, things like that. Second, based on that, we'll construct these personas and we'll work really closely with an organization to say, look, we know for a fact, based on all of this existing data that we have seen across, tons of folks that we have worked with at other organizations. And then second, with the data that you've been able to share, we'll construct these personas of how do we engage with these different types of folks And then over time, also update their information based on what they give us, update their language preference, communication preference, frequency, all of those different components. And then lastly, intelligently engage them using that, right? And layer on additional interventions over time. So I think that across the board, we've built probably one of the most comprehensive member engagement systems, quite literally everything from eligibility and enrollment reminders, reconciling contact information, guidance around benefits that different members are eligible for, and making sure that they understand exactly what resources are available to them, whether that's through SNAP, whether it's through private organizations that are offering benefits, whatever it may be, right? Care management pathways, even identifying at-risk members. If your organization is looking to make phone calls to specific members who are at risk of disengaging with a specific system or specific process you have in place, things like that, automatically transcribing those. And I think the last thing I'll touch on is we've developed an entire spectrum of mechanisms that we use for reaching out to these folks, right? So we've supported the system in 109 different languages now. And we can, as I mentioned, dynamically update that based on how folks will interact. We can reach out to caregivers and store that information, or any other sort of family members if they want those folks involved, which has been really powerful. Support multiple channels like IVR, SMS, email, integrations with apps, integrate with your existing systems and things like that. But really, we kind of view our technology as the most, as a highly logical extension of all of the content you've developed, all the data that you've collected so far will ingest, and then this will construct an entire strategy around member engagement, an entire, quite literally like a content toolkit for you that you can leverage over time. Last thing I'll touch on is just, we've seen a ton of, I think, statistics around one, how members actually engage with our platform and their activation rates. So I think the two statistics that we're proudest of is one, over not just these acute periods of time where you are able to engage someone for like the first 3 days that they get messages, but eventually they'll drop off. But quite literally over a period of several months, we've seen that on average, of all the messages that we send out to members, they're responding to a little over 70% of them, which has been really powerful. And that's across the socioeconomic spectrum. Even if you look at, populations in lower socioeconomic groups or above the age of 65, right? Those numbers are still in like the 65 to 70% range. The second statistic that's been really powerful for us is how many members after you actually reach out to them will activate and opt into receiving information from a particular channel. And because we take this, pretty comprehensive approach there at, if they don't engage with one channel, we can automatically switch to another channel, identify who needs to be reached out to, things like that. Our activation rate is a little over 90%, which has been powerful. And to date, we've worked with a little over 40 healthcare organizations. So yeah, I'll leave it at that for any questions. But I think really broadly, it's been great to see the initiative that Adaptation Health and the Louisiana group have put together so far, and excited to be part of this.